the birth time period they acquire this. Now coming to their pathophysiology is, you can say, describes under the four heading. First, there is the excessive secretion of the sebum. There is excessive secretion of the sebum. So let's draw one diagram and try to understand the scenario. See, this is the skin. Okay, this is the skin environment, and we discussed one unit called as the pliosebaceous unit. Okay, this unit consists of the sebaceous gland. Okay, here is the presence of the sebaceous gland, and this sebaceous gland, they pour, or you can say they drain into this unit. This unit consists of the hair shaft. This unit consists of the hair shaft, and they pour their secretion into this region. Okay, this region, and from here the sebum will excrete outside. Okay, and as we discussed that there is a presence of certain small acne vulgaris here. That's a normal micro environment of the acne vulgaris. Fine. Acne vulgaris nutrition is you can say the sebum. Sebum is basically a composition of fatty substance. Okay, sebum is a composition of fatty substance, and this fatty substance is utilized by the acne. You can say this bacteria. Okay, the cunibacterium. Okay, or also called as the P acne. But if you provide the too much, if there is a problem, and remember this gland, the sebaceous glands, it will triggered by the androgen hormones, and we know that when we attain the puberty, there is excessive secretion of the androgen, and this excessive secretion of the androgen will in turn stimulate the sebaceous gland, and sebaceous gland will fire and secrete massive amount of the sebum, and thereby utilizing the massive amount of the sebum, the propionibacterium population will, you can say, flourish. Okay, in a overpopulation manner. Fine. And due to their overpopulation, there is a blockage. Due to the overpopulation, there is a blockage in this area. Now what happened? The androgen is continuously secreted. Okay, the androgen is continuously secreted, but it won't find the space. It won't find the space how it can, you can say, excrete out from the internal environment of the skin to the external environment. Fine. So there is a blockage. Okay, there is a blockage. Now this blockage lead to the accumulation of sebum inside the skin microenvironment. Fine. So there is a bulging of this unit, and this unit is referred as the pliosebaceous unit. Remember this unit, okay, collectively they are referred as the pliosebaceous unit. So there is a blockage of pliosebaceous unit. Okay, and there will be inflammation, as I said in the starting of the lecture, that it's basically a chronic inflammatory disease of skin. So now here it's explained why it's a inflammatory disease. Understood? No problem. Now, so the first pathophysiological condition is the seborrhea. Seborrhea refers as the excessive secretion of the sebum due to the circulatory androgen. Now another one is follicular hyperkeratinization. Now this term follicular hyperkeratinization, it's refers that what androgens play, what are the role of the androgen in our body. Okay, the first or foremost thing which we have to keep in our mind related with the androgen is that it's involved in the development of secondary sexual characteristics. Okay, that's clear for us. But my friends, there is another, you can say, aspect related with the androgen. The androgen receptor is present on the keratinocytes as well as the sebocytes. Now what are the keratinocytes and the sebocytes? Sebocytes are the cells of the sebaceous gland. Okay, so the structural and the functional unit of the sebaceous gland is called as the sebocytes. Now that's the one thing, remember. And another thing is that the keratinocytes, which forms the first layer of the skin, that's called epidermis. In the epidermal region of the skin, there is a presence of the keratinocytes. Now these keratinocytes, they also possess the androgen receptor. Okay, And whenever endogen molecules or hormones bind with the keratinocytes, okay, it will grow. So the one of the function of the endogen is to grow the epidermis, okay, or you can say to repair the epidermis by repairing their fundamental cell, that is called as the keratinocytes, okay. But you know that whenever the endogen will you can say fire in a massive amount, there will be a hyper growth, and that condition is called as the hyperkeratinization. Fine, no problem. Now, and we also seen that this acne, this propionibacterium, okay, which is a part of the normal flora of the skin, okay, and their favorite nutrition is the sebum itself. Fine. So if there is excessive you can say secretion of the sebum, okay, then it in turn, you can say, overpopulate this normal flora bacteria, okay. So there will be a you can say overpopulation of the C acne or P acne. Remember, C acne refers to the cuniferum acne, and P refers as the propionibacterium acne, and both are the, you can say, the similar name, okay, similar name. And these all lead to the inflammatory condition, because their overgrowth can block this unit, pliosebaceous unit. Sebum won't find the, you can say, space to excrete out from the microenvironment of the skin to the external environment, and thereby it's a bulging of this gland, and that lead to the inflammation. You know, whenever this gland will bulge, there is a presence of the immunological cells, or you can say, you can call it as a inflammatory cells. There is a presence of the macrophages, okay, fine. There is a you can say presence of and some of the natural killer cells, and these cells, what they are doing, they are, you can say, minimizing the number of this acne, P acne population. Yeah, I know that this is the normal population, this is a normal microflora, but their overgrowth can lead to the, you can say, it can cause the pathetic situation, it can cause the skin disasters. So our immune cells know, okay, our immune cells know that I have to make this P acne population in such a level where it will not you can say become a causative agent of this P acne. So these cells start, you can say start coming in this region, okay, in this region, and thereby, due to the interaction between the inflammatory cells and like one of the inflammatory cells is your neutrophils, okay, one of the inflammatory cells is your neutrophils. So neutrophils will start acquiring N, and thereby it's form the pus, and contribute to the contributing in the inflammation, okay. So this is about the pathophysiology. Now this pathophysiology is not limited only here. As these glands, they overgrow, okay, they excrete out, or you can say they coming from the internal skin to the external region, and that's why you find the patient where there is a presence of the small bulging over the face, okay, that's called as the pimples. Now this pimples is first referred as a comedo. They are referred as a comedo, and there are types of comedo called as the primary comedo, secondary comedo, white comedo, black pitch comedo, which we see under the type. So this is the pathophysiology. Now coming to their cell type, as we discussed, that there is something called sebocytes, there is something called keratinocytes, yeah. There is something called the sebocytes and keratinocytes. These all are the cells. So if you present that diagrammatically their pathogenesis, then we have to understand that the endogens comes, it will stimulate the sebocyte and keratinocytes. Sebocyte will result into the excessive secretion of the sebums, referred as the seborrhea. Keratinocytes will lead to the you can say the follicular hyperkeratinization, okay, or there is a de-escumation means there is a de-arrangement of the skin integrity, and this all lead to the colonization of the P acne, okay, and thereby it causes the inflammation. So it is about their pathogenesis, which is about the bacterial pathogenesis, and the previous things we discussed is the pathophysiology of the disease. Now we already know the role of the antigen. Just read the slides, yeah. that the adrenal glands and the gonads secrete the androgen we discussed. We also discussed that the sebaceous gland and the outer root seed, that's called the keratinocytes of the follicular epithelium, have the androgen receptor, and androgen stimulate the sebaceous gland growth and the secretory functions. Now see the diagrams. So these are the certain types. Okay, these are the certain types. So basically we are discussing the histopathology, and remember that this acne is not always you can say lead to the inflammatory condition. Sometimes it's so silent that we won't clinically make a judgment that it is actually a acne vulgaris or it's actually a pimples. But if you can study it more, you can say in a micro level, then you will find it that the acne also consists of some of the non-inflammatory lesions, fine. So the types of non-inflammatory lesion, first one is the black-headed. Okay, black-headed. Here you see the black patches are present over the skin of the infected person. Okay, and in the next side you are seeing that there is a presence of the white head. Now this white head white head is the result of the coming the sebaceous gland outside, fine, no problem. Now coming to the inflammatory lesion lead to the development of the pustules and the nodules of the cyst. These are the three types of the inflammatory lesions of this acne vulgaris. Now, as I said in the initial part of this lecture, that we have to consider this patient on the, we discussed that there are certain diseases where we have to count the numbers. Okay, so here in the case of this disease, we have to consider the number. Okay, we have to understand their you can say the growth progression, how the acne is developing in their numerical respect, fine. So there is a, you can say, whenever there is an assessment of the acne, we have to you can say grade them. Okay, so there is a grading system. The one is called the grade 1, where there is a presence of comedones, mainly the open and closed type. In the second grade, it will develop into the papules. In the third grade, it form the pustules, and in the fourth grade, that's the chronic conditions, and that lead to the nodulocystic acne. Got it? No problem. Now discuss about some of the variants. Okay, discuss about some of the variants of the acne vulgaris. So what are the variants? The one variant is called as the acne conglobata. Okay, acne conglobata means what? When there is a presence of the two acne. See, there is a one acne present on the skin, and there is a second acne, and you can say by the overgrowth they will interconnect with each other. So this conditions is called as the acne conglobata. Okay, this condition is called as the acne conglobata. Then there is other conditions called as the acne fulminans. Okay, then other conditions called as the acne exochori, and then there is a infantile acne. Now this infantile acne, generally this acne development is related with the puberty, but during the infants, you can say in their delivery times, there is the, you can say, poor sanitation, then it can cause the acne in the infants also. It can cause the acne in infants also. So these are the certain variants of the acne. Now coming to the treatment, so mainly it's seen that mainly this acne vulgaris, it's subside itself. Okay, it subside itself when you cross the puberty age. Okay, then there is a, you can say, less secretion of the androgen hormones, and this acne will you can say go out naturally. Okay, you don't need to take the medication. But when it's you can say not present, when it's not limited to the skin only, or facial skin only, when it comes to the shoulder area or the back area or the trunk area of the body, then we have to look a good treatment. We have to look for the good treatment. So one of the, you can say, management is to practice the good skin care. Okay, one of the, you can say, one of the way to make and the free from this acne is to good skin care. Apart from that, you have to tell the patients, okay, the realistic approach, okay, the realistic expectation. This acne will not go in a 1 day or 2 day or in a 1 week. It takes time. As it takes time to develop, okay, it will take time to subside also. Fine. So it takes time. Then there is a use of certain topical medications. Topical medications refers to apply over the skin. Then there is the vitamin A derivatives called as the retinoids. Okay, so retinoids will bind over the sebaceous gland and make them, you can say, less less pleasant condition, means there is a less growth of the sebaceous gland. The androgen will secrete, okay, androgen will secrete, androgen will stimulate, but it will, you can say, disrupt the growth of the sebaceous glands, and thereby it will, you can say, make the sebaceous gland to secrete less amount of the sebum. Fine. Apart from that, there is a benzoyl peroxide, okay, and certain topical antibiotics like the clindamycin, topical erythromycin, okay. These are certain drugs, okay, which can which are the effective in the management of the acne vulgaris. Got it? No problem. And there are certain oral antibiotics, okay, but generally the oral antibiotics are, you can say, it's not always good to use, because sometimes the P. acne, which is a normal flora, it is developed the resistance, okay. So there is a multi-drug resistance, higher chances of multi-drug resistance related with the oral antibiotics. So oral antibiotics is the last regimen to use in the case of acne vulgaris. Rather, we can use certain the topical medications, or we have to have the certain patience, okay. We have to certain patience that it will subside naturally, okay. It will subside naturally. Fine. So this is all about the acne vulgaris. Let's conclude today's lecture. What we discussed about the first dermatological conditions, that's called as the acne vulgaris, commonly known as the pimples. Fine. We discussed about their introduction, okay, their etiology. Remember, the etiology is mainly associated with the hypersecretion of the sebaceous gland, and there is overpopulation of the normal flora, bacterium called as the propionibacterium, or also called as the C. acne. Fine. Then we discussed about the certain risk factor, that use of certain steroid drugs, streptomycin, okay, eating too much the lactogenic products like the yogurt, milk consumptions, excessive consumptions can exacerbate. There is a genetic predispositions. Fine. And there are other risk factors like you can say the poor skin care. This all can lead to the, it can all exacerbate the signs and symptoms of the acne, and sometimes it can itself cause the acne. Fine. But generally the acne development is related with the adolescent puberty attainment, where there is a you can say massive amount of secretion of the androgen. We've seen the role of the androgen. Apart from having you can say developing the secondary sexual characteristics, it's have also the receptor which is present over the sebaceous gland and the keratinocytes, and it's mainly the, you can say, grow these two cells, okay. Fine, no problem. Then we discussed about their, you can say, management. We discussed about the pathophysiology. We discussed about the history and the physical examination. So for each history and the physical examination, you have to keep the grading system in your mind. Fine, no problems. So it's all about the acne vulgaris. Hope you understood today's lecture. So thank you with having me. Bye. Have a nice day.